Okay, so you're just about a week after having had an endoscopic brow lift, which is basically an upper facelift just through hidden scars. Then we also did an upper lid blepharoplasty to get rid of some of the excess skin, shape the upper eyelid crease, and then also we did a lower lid blepharoplasty to reduce some of the fullness in the lower eyelid. Tell me, do you have any sort of comments, observations so far?
Everything's looking good. I will say the first 2 or 3 days were hard because of the staples with headaches.
We like to call them surgical clips.
Sorry, my surgical clips.
Yeah.
They're beautiful, yes.
Yeah.
But the headaches, they weren't bad.
Yeah.
But I just noticed that I had a few more headaches.
Yeah.
But after the third day, they were fine. And everything's looking good.
That's actually very typical. People from this procedure say that they have headaches, and it is usually about 3 days. I'm not sure that, I don't want to counter what you're saying, but I'm wondering if it isn't necessarily the surgical clips, because sometimes we will use sutures for patients who are like traveling out of town. I like to use clips for reasons that have to do with the potential for hair loss with sutures.
Okay.
Having said that, even without the surgical clips, patients will sometimes refer to a headache. So hard to know, it might have been, especially if you're like laying on it.
Yes.
Yeah. All right.
True.
Yeah. And then I think it's worth mentioning, and I appreciate you allowing us to discuss this, is that for a specific reason that has really to do kind of with you, we had to use blood thinners right after surgery, which is not something that's common. But the reason I point that out is for two reasons. One is to say we do see a little bit more bruising in you than is typical, and we kind of have a good explanation for that with blood thinners. Even if you don't have outright bleeding, you're going to get a little bit more bruising. But then the other thing that I think is important to mention is that these surgeries can be performed safely in patients who do have to be on blood thinners. Not all clinical scenarios hold true for that statement, but many patients who in the past we might have said, it's best not to do surgeries, we've developed post-operative protocols to do them safely. So I appreciate you letting us talk about that.
Yes.
Yeah. All right.
I appreciate it.
Okay, and we'll see you in 2 months.
Thanks.
Okay.
Perfect.
All right. Thank you.
Mm-hmm.
All right. Bye-bye.